In the previous video, we discussed 2 Danish studies that reveal some of the most important information we have about hormonal birth control and mood. We looked at the different methods of birth control and their link between depression, and the numbers were quite interesting. Although we cannot prove that birth control directly causes depression, mood issues on the pill are common. And studies show that almost half of women that go on the pill stop using it within a year because of intolerable side effects that are mostly psychological. So, what is the deal with birth control and mental health? I decided to look deeper into this topic in hopes to find some answers, and I found some pretty interesting information that I am really excited to share with you today. I first learned how the pill alters your stress response when I was reading This Is Your Brain on Birth Control by Dr. Hill, and I was shocked to learn that women's stress response on the pill seems to be the same as someone who has experienced chronic stress or trauma. Women's stress response on the pill seems to be different than from the stress response of a naturally cycling woman. And I'm not talking about the fight or flight response here, so no need for panic. Let's get into it, shall we? I'm talking about a part of the stress response called the HPA axis, which consists of your brain, pituitary gland, and your adrenal glands, which are the little hats that sit on top of your kidneys. To put it simply, a normal stress response goes a little like this. When you experience chronic stress or trauma, this neat little system that is designed to cope with stress gets chronically activated. This means that your adrenal glands will just keep producing more and more of the stress hormone cortisol. Our bodies are equipped to cope with stress, but not chronic stress. Chronic stress is very dangerous to our bodies. It can increase your risk of infection, weight gain, and even brain damage. Chronic cortisol signaling is so damaging to the body that when this happens, the body does what it can to shut it down in order to protect itself. Your body can simply not function in a state of chronic stress, which is why the HPA axis starts to hush itself down. And to my knowledge, this seems to be what is happening to women on the pill as well. When the stress response shuts down, it makes it more difficult to cope with stress, because the very purpose of the stress response, the reason why it's there, is so that you can cope with stress better, or respond to stress better. So of course, when you lack this response, it will make it more difficult for you to cope with your surroundings, and this can impact your mental health in a big way. We often talk very badly about our hormones, but it seems to me that when our hormones are in balance, everything is in place and we can feel our best. Just think of your hormones like the ingredients in a recipe, for example, a cocktail. What will you need to make the perfect mojito? Well, you will need the right amount of sugar, mint, lime, soda, etc. Too much sugar can make it too sweet, almost sickening. Too much lime will make it too sour. And it's the same with our hormones. We need the perfect amount of the right hormone at any given time of our cycle. And when we have that, everything is just like a perfect mojito, right? So let's talk about our natural hormones and their pretty cool benefits. Did you know that our natural hormones provide us with our very own chill-out drugs that work similarly to alcohol and anxiety drugs? It's a really cool thing. Let's talk about it. Your sex hormone progesterone causes your body to produce something called allopregnanolone. It's hard to pronounce, but in other words, natural chill-out drugs. These chill-out drugs, just like alcohol, bind to some receptors in your brain called GABA receptors. And when this happens, you feel calm and chilled, like you are relaxing on a beach with a mojito. Let that sink in for a moment. Our hormones are providing us with our very own relaxation drugs, and that's just one of the many benefits our hormones have. So it's no wonder we struggle so much mentally when we have hormonal issues, right? So what happens to these natural drugs when we take hormonal birth control? Unfortunately, the synthetic hormones in the pill lack these calming benefits that our natural hormones have, and we therefore miss out on those benefits when going on birth control. Research shows that after being on the pill for 3 months, women will have significantly less chill-out drugs in the blood. Studies also show that mental health disorders such as panic disorders, mood disorders, bipolar disorder, and even heavy PMS are all associated with lower levels of GABA activity. Sarah Hill makes an interesting note about alcoholism and how women on the pill possibly could have an increased risk of alcohol dependence if they have alcoholism in the family. Now, given what we've spoken about today, it's not so crazy to think that some women might try to calm their brain with using alcohol. Naturally cycling women will, as we talked about, have a fluctuation of their hormones. Estrogen and progesterone will go up and down depending on where in the cycle the woman is. When estrogen is high, which happens around ovulation, some women will report having more energy, increased libido, and better mood, for instance. If you have a natural cycle, I invite you to check in on how you feel at the different phases of your cycle. And you might be able to notice a pattern. For example, I myself feel more creative and confident during the ovulatory phase. What the pill does is that instead of allowing this flow and fluctuation to happen, it creates this static state where there is no ovulation and therefore no spike in estrogen each month. Instead, it keeps estrogen low throughout the cycle, and with no ovulation and no rise in estrogen, you will not get the same experience. So what experience do we get? Well, we don't fully know. The research is not clear, and there are so many gaps in science when it comes to women's health, and especially within women's reproductive health. But what we do know is that hormonal birth control does not just affect our reproductive organs, it affects our brain, which then affects other things in the body. So even if we don't know what experience we get when going on hormonal birth control, we do know what experience we want when going on hormonal birth control, right? We want the perfect mojito experience, or the summer breeze experience if you don't like mojito. My point is, by talking about the pill and its possible side effects, we're already opening up the discussion to a very important topic, which is how do we feel on birth control? And this topic is exactly what we are going to discuss next Monday in part 2 of birth control and mental health. I hope you got some value from this video, and if you did, you can subscribe for more videos like this. I'm sorry I'm being so slow with uploading videos. Life can be pretty crazy sometimes, and to be honest, it's not always a walk in the park either. But I'm so grateful to be here and to be talking about these important topics. And the good news is that this month there will be a new video out every Monday, and I'm so excited because we are going to discuss so many important topics, and I can't wait to see you next week for another episode of All About Hormonal Birth Control. So stay tuned for that, and I will see you soon.